This triangular one running down like this is the cervical trapezius. The one running along the top of the back here is the thoracic trapezius.
Right.
Okay. The one running right below it is the latissimus dorsi. Okay. And the one that we cut out of the armpit, because it attaches to the skin, this one right here is cutaneous trunci. Okay. The runs running down the middle, which are kind of underneath these glands, but they're running down the middle and then they split like that, so you can still see the back part of it.
Yeah.
This is the digastric.
Right.
Okay. So here's the spinodeltoid, right? And then if we look behind it, we even have to like move it up out of the way a little bit. We'll see the infraspinatus and the teres major, right?
Right.
Okay. Then let's see. So here was the cervical trapezius going down. At the base of the cervical trapezius, you should find one going perpendicular to it fairly. And that is the going across the shoulder. That is the omo transversaris, and you can see it right there.
Yeah.
Omo transversaris. Omo transversaris is right here, going across the shoulder. Okay? Alright, if we do some of the neck ones. Alright. You should have like a V here and a V on that side. Let's look on this side. Here we have the V. We move all the glands out of the way. And here we have a V, right? The ones on the inside go from the sternum to the mastoid, so they call those sternomastoid. The ones towards the outsides go from the clavicle to the cervical vertebrae, so they call those clitocervicalis. And the ones that are going between here, that go from the sternum to the hyoid, we call those sternohyoids. Here's a better image of the digastrics underneath there. If you move these sternohyoids to the side, you should find the trachea underneath. Okay. Now, for the deeper neck muscles, you look at carefully for the clitocervicalis right here, and it actually splits into two. And it starts with the clavicle, but it's going to end with the mastoid. So we call it clitomastoid. Okay? You should find it over here also. Then running, if we cleaned up in here a little bit, you'd find the same exact thing over there. Now going the opposite way of the V's, you see one going to the hyoid, going from the shoulder. So from the shoulder to the hyoid, we call that omohyoid. And that's this one right here.
You can see it on the other side pretty good too, I saw.
Can we? Yeah, there it is. Right here, this one.
That's the omohyoid.
Omohyoid. And if we, when we do the muscles back here, when we find this one right here, that's omohyoid. And you'll see that when we pull on it, we've got the right muscle.
Oh, that's right.
Okay?
And the omohyoid goes to the shoulder?
Right. So when we cut and reflect the shoulder back, it's affected. You know, you can keep it intact, but you can definitely see it pulled on. Alright, so now for this area right here, we have this muscle going from the clavicle to the arm, clitobrachialis. We have the pectoralis here. Only know it as pectoralis. Don't worry about profundus or superficialis or anything like that. If we open up the pectoralis, we will see inside a very skinny, thin rectus thoracis. This is the rectus abdominis. And behind that you have scalenus. Remember, serratus are ones that have like serrated appearances because they insert into ribs. So here are the serratus ventralis. You can see that the points are located ventrally in relative to these serration points up here. Let's see if I can't mutilate it. Do you guys see these up here? These are definitely more dorsal.
Okay.
So this is the serratus dorsalis. This one that's been cut right here is the serratus ventralis.
Okay.
Okay? When you cut the latissimus dorsi and the thoracic trapezius, you will look more clearly here at the serratus dorsalis, and if you find a spot, you can see that from the muscle. So see how when I go under it, it's pink. It turns clear.
Mm-hmm.
This is an aponeurosis because it's like a sheet of connective tissue to the spine or wherever it's going. Underneath this clear tissue, you can see a muscle going lengthwise. So underneath this tissue right here, this muscle, the aponeurosis of this muscle, you see this muscle here, that's the erector spinae, okay? One of the epaxial muscles. The other epaxial muscle is totally obliterated, but it would have been this one right here, called the splenius. Okay?